Where's the clicker? It's over there. So, welcome everyone to the closing session of the European Public Health Conference. How have you all been enjoying so far? It truly has been an amazing week. It was so wonderful to have you all here with all the science that was shared, with all the experience that we shared with each other, with all the new projects that will spark from these interactions we had here. And indeed, there was an overwhelming sense of accomplishment from our side to have you all here and to see what this community, this public health community can do when it gathers. We are truly humbled and impressed. Thank you so much. This was the topic of the conference, as you well know. Sailing the waves of European public health, exploring the sea of innovation. And indeed, we did sail the waves of European public health, waves of knowledge, waves of experiences that we all have. We did share this sea of innovation, and we'll have the chance to listen to some more just in a couple of minutes. But I wanted to tell you something as well. It was a pleasure being the chair of this conference. It was truly an honor to do that. But we had a big concern. We wanted to give you a canvas so that you could create. Because it's not me that did the conference, it was you. And therefore, we gave you this canvas, and you filled it with so much wonderful experiences that we really can't even put a name to it. So thank you so much to all of you for being here for this amazing experience. Thank you so much. It's now my pleasure to introduce to you a good friend. Ricardo Baptista Leite is a doctor we've met in medical faculty many years ago. Not so many, we're very young. We somehow share a common course in health and in public health. He is now the CEO of HealthAI, so I'm very happy to introduce to you Ricardo. Ricardo, you have the floor. Thank you so much for coming here.
Well, thank you. Thank you so much, Ricardo. Hello, good afternoon. As you can see in Portugal, to work in public health, you have to be called Ricardo. It's a prerequisite that we all have to have. So has Lisbon been treating you well? Yeah, okay, great. I was hoping for more, but I'm gonna ask, has Lisbon been treating you well? Okay. Oh, well, so Ricardo and I would go to the mayor and complain, but that way we can send him good news. So I'm gonna be talking to you a little bit about artificial intelligence. So I'm the CEO, as Ricardo was saying, of the Global Agency for Responsible AI in Health, and we'll get to that in a second. But the first question I wanna ask you is, why do you want to use AI? So I've been traveling around the world. As a global agency, we work with governments. We're a nonprofit, working as a collaborating partner with governments. And many times I see, be it private institutions, public institutions, wanting to use artificial intelligence, but why they want to use it is not very clear. Most of the times it's because it's a new shiny object. It's the buzzword that's out there. Well, some people tell me, my boss tells me I have to do something with AI. And we need to make sure that we know why we want to, especially in health. And actually in health, AI is an opportunity that is in front of us to be able to transform health systems. And being within the public health community, one that I'm very proud to be part of and I love being part of, I think AI is one of the greatest opportunities we have ahead of us. And we know that the costs when it comes to healthcare have just been constantly on the rise. And it's the same everywhere in the world. And with the costs, we have seen a rise in the burden of disease, which leads to tremendous risks of lack of sustainability of health systems. And when health systems are not sustainable, it means some people will be left behind. So the idea of universality is lost. Worse health will be the consequence, especially for those living in most vulnerable situations. And that leads to more inequities and poverty in a vicious cycle where you end up with a two-tiered system, one where you have people who actually, with resources, have access, and those that don't have resources end up on waiting lists. And that group will just continue to grow. Europe has been proud to be able to work towards universality, but if we don't change the way we are delivering care, we actually may end up with the sad reality that we are seeing, for example, in the United States. So when you're doing something in your health system, you should be doing one of 5 things. If you're dealing with a preventable disease, prevent it. If you're dealing with a curable disease, cure it. If it's neither preventable or curable, you need to at least control it or manage it. Or, especially end of life, we need to make sure that we're minimizing suffering and malaise. But if you're doing something that allows you to cut costs, that's also useful. But if whatever you're doing in your health system is not contributing to one of these 5 factors, you better ask yourself, what the hell am I doing? And the truth is, a lot of things that are happening in the health system are not contributing to these 5 things. And because in public health, we love acronyms, I've called it the PMC4 decision-making framework. The truth is, health systems, especially in the Western world, have been industrialized. There are many reasons for that. I don't have time to get into it. But we have focused more on process, on procedures. We have rewarded the number of surgeries, the number of consultations, the number of clinical acts, the number of exams that we perform, not asking ourselves if that is leading actually to better health for all. And so since I deal a lot with politicians, I use cartoons. It's nothing against you. It just gets a message through. And you can see here, the modern hospital is a factory. The carrot is your incentive system. Let's call it financial. You can have many incentive systems. The carrot today in that factory is paying for the number of surgeries and number of procedures that are happening in the hospital, no matter what the outcomes. And so, the value-based agenda that you're all familiar with is taking that carrot out and putting it where the patient is, focusing on health outcomes, on PREMs, on PROMs, and that is a vision that has been defended. And today we know that outcomes matter, and we see here how, in countries that have very low resources, if you pump in a little bit more money, you actually do get outcomes very quickly on the rise. However, when you reach more or less Singapore, one of the more efficient systems in the world, you see a plateau. And that plateau actually dips a bit when you go to the US. No matter how much more money you put in, you don't get better outcomes. And the reason is because it's a disease reactive model that will constantly lead to a rise of burden of disease and a rise of costs. With the value agenda, focusing on that carrot shifting to the patient, I believe with the same money, you can get better outcomes. But the problem is you'll reach a plateau also, because it continues to be a model focusing on reacting to disease. So the question is, how do we go beyond that? How can we consistently focus on improving health and quality of life and well-being in a sustainable manner? And to answer that question, we need to understand, which the public health community knows so well, what actually influences an individual's health status and clinical status. And the truth is, as a medical doctor, when I'm looking at a patient, I'm looking at 10% of what actually impacts their health. 30% are biological factors that there's a lot of technology coming out there that will shift genetics and so forth, but we still have a long way to go. 60% are environmental, social, economic factors, behavioral choices. And so if we are to take this serious of changing from a disease reactive model to one focusing on health and well-being, we need to take the carrot out of the health system and put it in the community, and creating financial incentives towards lowering the burden of disease. We need to make sure that if the managers in a community are able to get rid of all of the disease, they should be rewarded and not the other way around. Today, we are incentivizing those that are actually able to find more and more sick people instead of focusing on making them healthier. And so you can use metrics like using another bad acronym that I created, CBOMs, so community-based outcome measurements. So saying all of that, we know that all of these factors that influence our status in terms of our health status as individuals relates to a lot of data. And the truth is, we've known this for a long time in the public health community, but using that data and transforming data into information and transforming information into policies and policies into impact has been a difficult journey. But with the power of artificial intelligence, we can actually transform the way we deliver health and care. And we're already seeing a lot of AI technologies being put out there. When you look at research and development, the acceleration of new molecules that are being produced, when you see manufacturing, distribution, and logistics, but population health, predictive analytics used in the population health field, and even in the delivery of care with robotics, with the clinical decision support tools, post-care and monitoring, and even on the management side, predictive analytics in terms of measuring how many hospital beds you'll need or managing your waiting lists. But when applying artificial intelligence within your health system, please stop, think, how can I redesign, rebuild a health system of the future, and not try to retrofit the AI into our current analogical way of thinking of our 20th century industrial model of care. Using this opportunity, having a transformative technology at our hands, how would we design the health and care system of the future, not based on where we are today, but where we want to be? And so we're seeing a lot of companies popping up around the world. US, China, India, these are all areas. Europe is in between in terms of startups, as you can see here. But mind you, low and middle income countries, Latin America, Africa, many Southeast Asian countries are absolutely absent from this map. So AI, which actually can potentially be one of the greatest equalizers of our time, can actually become one of the greatest dividers. As a public health, global health community, we need to be conscious and active to combat the digital divide. Moreover, when we look at patents, the latest patent reports shows two things. We are seeing an exponential growth of patents when it comes to AI. 61% of those patents were registered in China. 21% were registered in the United States. 2% were registered in Europe, plus UK. I'm putting UK and Europe together. When you look at that data, it goes to show, and of course, if you adjust the quality, it's not as bad, but still, it shows that there's a trend that will impact health in Europe. As a European health community, this is something you cannot ignore. And we're seeing AI being used in different settings. There's this JAMA paper. Parts of it have already been contested, but the spirit of it is what it matters for this talk. It was if you can call it a trial, where patients were responding to virtual bots without knowing that. And they were talking to a chat bot. Half of the answers the patients were getting were from medical doctors. The other half were robots. And in terms of outcomes, the author said that the outcomes were better with the robots. That's the part that's been mainly questioned. But then when asking the patients who showed more empathy, the robots won again. Let that sink in a bit. So that means we need to rethink the role of humans in healthcare. And we need to rethink the way we're training our health workforce. Because a lot of people say, oh, robots get better outcomes than humans. But also, what we don't talk enough about is the combination of robots plus humans normally beat both scenarios. So it's that symbiotic approach that can actually bring us tremendous advantages in transforming health systems for the future. But we also know that, especially in health, if something does go wrong, we need to make sure that we have systems in place to mitigate risk, to make sure that legal liability is clear, to build trust towards the technology. We need regulation and we need governance of AI. And there are many challenges. There's a global fragmentation. There's a race to regulatory approaches to AI, which will make access and acceleration of innovation a nightmare in the future. The fast evolving AI makes it impossible for parliaments and governments to keep up to pace. I served 4 terms in parliament in Portugal. It would be a disaster to leave it up to parliamentarians to keep up to pace with AI. Honestly, don't do it. What we need to do is light legislation, effective regulation. We need to transit the power to the regulators, which means politicians giving up a little bit of power, but making sure that the regulators have the capacity and the resources to make sure that they keep up to pace with the technology, or else we will not stand a chance. We need to address the data issues, which Europe has been in the forefront, but also post-market surveillance. If something goes wrong, we need to detect it early on so that we can protect citizens, once again, to build trust, mitigate risk. When I prescribe an antibiotic as a physician, I'm concerned about if that is the best antibiotic at the right dosage for the patient in front of me. I'm not thinking about the safety issues because I had a regulator who took care of that for me. I need that same logic when it comes to AI. Today, healthcare managers, doctors, nurses, pharmacists, they're afraid to use many of these technologies because they don't know if they can trust them. So we need to create a governance model that can address that. So at HealthAI, as the global agency for responsible AI in health, we are trying to address exactly those challenges. As a nonprofit based in Geneva, we're partners with the World Health Organization and implementing technical partners for governments around the world. And you can imagine us as a bridge. We're in between those international organizations that are defining standards like WHO, OECD, UNESCO, ISO, all of those. We do not define standards. And on the right side of the bridge, you see the governmental regulatory agencies where we see the power to assess and validate technologies, to make sure that technologies are safe, effective, and quality assured when they go into the market, putting in place post-market surveillance mechanisms. So we're actually creating a global network of regulators that will allow us to have a global early warning system. So if an AI tool shows risk in Singapore or Brazil or in Switzerland, all regulators will get a red flag in real time so that we can partner the regulators working with the private sector to find solutions for those technical challenges, to mitigate risks, to avoid harm at scale. And in this sense, we are actually helping the private sector deal with their legal litigations, to deal with their reputational risks, but most importantly, as governments, making sure that citizens are safe, and we are building a community of trust that allows us to use and scale these technologies. And that's why we have created a community of practice at HealthAI, which you are all invited as institutions to apply to. This community will bring together governments and regulators, academics, centers, patient organizations and civil society, technologists and private sector. Everyone is welcome who is part of this ecosystem precisely to be part of that conversation, to make sure that we can co-create that governance, global governance model to make sure that we build trust towards AI and make sure that we implement it towards leading to better health for all. Thank you very much.
A small gift.
Thank you.
Thank you, Ricardo, for a very inspiring talk. Okay. You didn't think we would let you go without the physical activity, right? So please stand up if you can. And now this is, there's an added value to this one. Because, as you can see, there are no physical trainers here today. So you're stuck with me. But even worse, I'm gonna check whether you were paying attention yesterday, because we're gonna dance one of the dances from yesterday. So basically just go 1, 2, 3, 4, 5, stomp, stomp. 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 Yeah! 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 E-R-O! Yeah! 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 E-R-O! 1, 2, 3, 4, 5, stomp, stomp. 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 Yeah! 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 E-R-O! Yeah! 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 E-R-O! Thank you so much. So, this was indeed one last dance, but eventually we'll meet tonight, so don't keep your hopes up. I'm going to call Charlotte now on stage.
Hi again, everyone. So we are here in our EPH conference. That's amazing. We're discovering many scientific research, but in all workshops and plenary, we've been saying, how do we get that to the public? How do we get that to the policies? And how do we get that to the countries? Because often, most of you come back with many ideas, many inspiration, and you want to get leaders, and then you're in your country and you're a little bit more alone, right? So that's why we have European Public Health Week, and this is my bad. I forgot the logo on my slide. really sorry. European Public Health Week is with the European Commission, with WHO, with the Observatory of Public Health System, and it was an idea from the Austrian Public Health Association. Last week was a success. We did many things. How many of you participated in European Public Health Week? Good, thank you. But one country did much better than the other, and that's stimulating for you. We'd like to call Professor Desislava Vankova, please, from Bulgaria. Congratulations.
Thank you, Charlotte.
Thank you. There you are, an award for you and a present,
Shall I say something?
if you want to. There you are.
Dear Charlotte, dear organizers, thank you for acknowledging our activities during the Public Health Week. In fact, you give us the canvas to draw in it, so we celebrate during this week our public health values. Thank you.
Thank you.
Thank you.
And next year, 12 to 16 of May, you get a chance to compete with Bulgaria. We have 3 themes that are really important: mental health, and we will focus on the public health and healthcare worker mental health and well-being; global health, healthy aging, multimorbidity, but probably not only. We will keep one day led by the youth, and again, congratulations to EUPHA Next and all its partners. You did an amazing job. But we also wanted to engage you, so we put on the app the possibility to vote for a theme. And do you know who wants? Do you want to know who the winner is? Health equity and social determinant of health. So we are back really public health. We are counting on you to do many things. We will do a hackathon in Brussels. You can do anything you want in your language. You can do in-person online events, but more than anything, we are here for you, to support you. And now I would like to invite Martin, he's here, to give more prizes. Floor is yours, Martin.
Thank you very much indeed, Charlotte. And this is the time that I wish that we were able to give prizes to everyone. It has been a remarkable conference. We have had absolutely amazing presentations, but the reality of it is there do have to be winners. So we have a number of awards to give out, and the first one is for the Best Poster Award. So could I invite, if she is still here, Angelika Valls-Gries for her poster, the Best Poster Award for Health Impact Assessment in Personalized Prevention, 3 applications in pharmacogenetic testing. Angelika, congratulations. There we are, and I think we should, okay, well done, congratulations. And now we come to the highest scoring abstract award, and there were some very high scores. In fact, so many that we have a tie for first place. So the first one of the awards for the highest scoring abstract is Karin Stalan-Niemann, Labour Market Participation in People with Intellectual Disability, a follow-up study in Sweden with a score of 6.5. And is Karin here? Congratulations. There we are. There we are. Okay, thank you very much. Well done. And the tie for first place, can we have Anouk van Dunkerken, whose abstract was pandemic-related PTSD and associated risk factors in the general adult population in the Netherlands, also with a score of 6.5. Anouk. Congratulations. Yeah. But just stay there for a minute, because we have another award to give. And this is the Ference Bojan Young Investigator Award. Ference Bojan was a very good friend of mine. We worked together in the transformation of public health in Hungary in the early 1990s. He's a former president of EUPHA, but he died tragically in a road traffic accident in Hungary in the mid-1990s. And this award was established in his name. So it is a great personal pleasure, because Ference was such a good friend, to be able to present you with the Ference Bojan Young Investigator Award. Congratulations again. Thank you. Thank you very much. Ricardo, over to you, I think. Well, I will then introduce, so let me now pass on to Iveta, who needs no introduction.
I'm looking for the pointer. Okay, thank you very much. So, good afternoon, ladies and gentlemen. It's my great pleasure, dear colleagues, dear EUPHA colleagues, dear friends, dear partners. It's my great pleasure to stand here before you for the last time as the EUPHA president. And I have to say, it has been a long journey. It has been 4 years and 8 months. And I would like to highlight a couple of milestones. First of all, let me start in the beginning. There were 4 people who convinced me to apply for the position of the EUPHA president: Dineke, Natasha, Martin, and Christina. And I'm very grateful to them for seeing the potential in me, for their encouragement and for their support. When I started my EUPHA presidency, I was reflecting on what added value I could bring as EUPHA president. And 2 ideas stood out: moving from silos to synergies, bringing together various fields, disciplines, and sectors. And the second was innovation. These ideas were later transformed into the work of EUPHA and also into our new strategy. I was a part of the team that developed the AAA strategy, and I thought that it would be impossible to create an even better one. However, I'm very proud at our new 4 E's for You strategy. EUPHA is here for you. During my presidency, I faced several challenges, both external and internal. 4 executive directors, staff shortage, and financial difficulties. And last September was particularly gloomy. We had no executive director and only 3 people in the office. Fortunately, after the long search, we found Charlotte Marchandise in October, and the future began to look much brighter. There were also several firsts during my presidency. I was the first person elected from the Central and Eastern European country. I was the first non-medical doctor. Our journal transformed to open access. We signed our first memorandum of understanding with the WHO Europe. For the first time, we had to close the registration a month before the European Public Health Conference. And also, first time, we introduced the Pechakucha workshops. Serving as a president has been a deeply rewarding experience. I had the privilege of being a member of several advisory committees at WHO Europe, and the European Commission. I was invited to speak at more than 40 events. After analyzing the titles of my presentations, the topics I most frequently spoke about are shown in the word cloud. Here it is. I also learned a great deal about leadership and global diplomacy and also collaboration. And this conference is particularly special to me because I have attended every EUPHA conference since 2001, except for Lisbon, when my son was born. And to conclude, I'm deeply grateful for the support of the EUPHA community, our partners, and every member who has been part of this journey over the years. Thank you to the old EUPHA staff and the new team. Thank you to my dear colleagues from the Slovak Public Health Association and the university. Big thank you to my closest collaborators, Dineke and Charlotte. Dineke, who has been with EUPHA for 25 years, and Charlotte, who will no doubt be here for another 25 years. Their energy and passion for EUPHA are unparalleled. Collaborating with them felt like being a part of a perfectly tuned cogwheel moving in great harmony. My special thanks goes to my boys for their endless love, tolerance, and support, and to all of you, the EUPHA community. It has been an honor to serve in this capacity and to work alongside such talented, passionate, and committed individuals. Each of you has shaped my journey, and I carry many, many precious memories with me. I leave the position as the EUPHA president lightheartedly, knowing that I'm living in excellent shape and in excellent hands. Thank you. Unbelievable. Unbelievable. Wow, unbelievable. I really did not expect it. Thank you so much.
Thank you, dear Iveta. My name is Tiit Albrecht. I'm the new president of EUPHA. Iveta set the bar very high. I have heard this many times. I hope I will be able to at least follow decently in your tracks. We have worked together in different capacities over the years, in this almost the same period as Iveta described. I will give you just a few points from my program, which will indicate also some of my key priorities that will define my goals and my objectives. The first one is Europe. Europe as the continent, as one continent. There are no 2 or 3 Europes. There is one Europe, the Europe defined by the WHO Euro region. We have global challenges, but I think we have very decent and honest European answers to these challenges. And we have to promote what we are strong at, and in Europe we are strong at social justice. Social justice should be one of the cornerstones of our activity in public health. My second priority is the youth. Yesterday I had the opportunity to meet with EUPHA Next. We had a 1.5-hour discussion, very inspiring, very encouraging, knowing that there are so many inspiring young professionals in public health who really work in very many fields and are going to move the science of public health forward. We need to think young because that's the future. We think we need to support young researchers, and we have to support young populations in our societies and communities because they are the soul of the future generations. My final goal is, of course, public health. Public health as a comprehensive objective, public health with all the challenges running from the standard public health all the way through the global planetary public health, climate change, and other challenges we are facing, never forgetting that we have to outreach to the entire population of the globe and, of course, work actively in our local communities. Focusing on certain aspects, supporting the digitalization, modern tools, and, of course, addressing all determinants, including the commercial determinants of health. So much from me. I'm looking forward to the support of all of you, and I promise I will be a dedicated leader to all of the initiatives that you are going to present to all of us.
Tit, your speech was very convincing, so I'm handing over to you officially the EUPHA tool. And I think
Thank you.
you're welcome. Okay, now let me say a couple of words and hand over to another person. Martin McKee's dedication to advancing public health through his work with the European Public Health Association has undoubtedly left a permanent mark on the field. His leadership and vision have not only strengthened EUPHA as a platform for collaboration, but also inspired countless public health professionals across Europe to champion health, equity, and innovation. With his persistent pursuit of evidence-based policies, Martin McKee has been instrumental in shaping strategies to address pressing health challenges. His ability to unite diverse stakeholders reflected in his deep commitment to fostering a healthier, more connected global community. Martin McKee's legacy will continue to resonate, reminding us of the profound impact of the visionary leadership in the public health. So Martin, could you please come to the stage?
Thank you. Thank you very much indeed.
Thank you.
So, in fact, the Iveta may think that she's actually escaped from all of this, but she hasn't. First of all, the past president remains on the Executive Council as the past president until we get yet another president. But the other thing you do, and this is where I am now handing over something, and to echo the thanks and the tributes that have already been paid, is that some years ago we split EUPHA from the European Public Health Conference Foundation. They're two separate organizations, and for a whole series of reasons. I've got some good news and some bad news. So I'll start with the bad news first, because once you take over from me as the president of the Conference Foundation, you are actually the chair of the board of directors under Dutch law. So if it all goes wrong, you're responsible.
Right. Okay.
The good news is that the chances of it all going wrong are extremely remote, because we have been going from strength to strength. We're now at, we cannot fit everybody in, 3,100 here. But the even better news is that you will be supported by a truly amazing team,
Yes.
with Floris and his colleagues, Jose and Lydia and all the, I won't name everybody, but all the others. So you can be absolutely confident that you will be supported in all of that. So I don't have anything to hand over to you physically. Right. But this is the active handover.
Thank you, Martin.
Thank you very much.
Thank you very much.
Thank you.
And
yeah,
I mean, we should perhaps stand here.
Yeah.
Thank you. Thank you, Martin. And I was a little bit quick with my thank you to you. I have a present for you.
Oh, thank you.
As an appreciation for everything what you have done for EUPHA. And just like me, you will not escape either, because Martin is going to be the special advisor to the EUPHA Executive Council. And the words which I said were very honest, because we deeply appreciate your wisdom, your leadership, your passion for EUPHA and the public health community in general. So Martin,
Lovely.
Once again, thank you very much.
Thank you very much.
It has been, oh, maybe we should
Thank
also.
you.
Thank you. Sorry.
There we are. Mm.
Oh.
Thank you.
These formalities because of the pictures.
And apparently, we then also have one of these statues.
Yeah.
For
Okay.
Iveta.
Yeah.
So let me just put that down.
So
you can see how well organized I am. I do have a script, but it hasn't gone exactly to that script. So again, congratulations. One for you.
Thank you. Well, one thing that I learned in EUPHA is improvisation.
Exactly.
Yeah.
Great.
Thank you very much.
Ricardo, over to you, I think. Or is to Charlotte.
Well, yes, it will be over to Ricardo. But over to Ricardo and Sonia, I would like to say a very big round of applause to the two chair of Lisbon Conference. Sonia would like to come, Ricardo too. I mean, the crowd is absolutely unanimous to say you've been doing an amazing job. And we'd like, on the name of EUPHA, to give you a present for you too. You don't get statues. It's when, if ever you become president. But with all our gratitude, I want to say also that my big secret, non-secret plan is for Evita to become president of her country in the future. So I think you did a great job and you can go there. And I think you also are going to have a much more stronger political leadership after this conference. So we are counting on all of you to change the world. Thank you.
Thank you, How many of you know what this is? This is the conference bag from the Helsinki conference in 2007. So I'd like to invite Ilmo on stage. I'm not going to give you this because it's a dear item I have, but I'm going to give you the sardine. And I have to say, some of you might be aware that it was supposed to be Helsinki before and then Lisbon. But we were very happy to switch, not because we were able to do it before, but we realized that construction work also gets delayed in Finland and not only in South Europe.
So, good afternoon. There is really many of you. That's amazing because quite often these occasions been not so crowded. I'm happy. This is giving a good testimony for your endurance. You've been thanked already by Ricardo, and so I want to thank once again my colleagues in the European Public Health Conference Foundation, Executive Board, International Conference Council, International Scientific Committee, and of course, Conference Office. And of course, I would like to thank Ricardo and Sonia and other Portuguese organizers for this great conference. As always these days, filled with interesting speeches and discussions have been very rewarding. Here in Lisbon, we have Sailing the Waves of European Public Health and Exploring the Sea of Innovation. However, now I would like to steer our ship towards the north, towards Helsinki, Finland, which invites you to the next European Public Health Conference in November 2025. The idea of Finland in November may sound cold, but I'm sure our good collaboration will bring warmth and to our next encounter. And a little of Finnish sauna culture may help as well. So you are invited to visit one of these saunas in Helsinki. You may be interested in coming and seeing in person the people that despite the darkness of Novembers are ranked as the happiest country in the world by the World Happiness Report. So most of my research career, we've been criticizing the governments and their policies, but considering this happiness record, the Finnish society must have done something right to provide this kind of opportunity for happiness. Finland has changed enormously during my lifetime. When I was born in the late 1950s, Finland had been living in an era of post-war reconstruction and rapid population growth for quite a while. The baby boomer generation had been born, and more schools, apartments, health services were needed. Finland was getting wealthier and more urban and industrialized at a rapid pace, but it still remained an agricultural society. When I was born, Finland had, for example, third least doctors, medical doctors per capita in Europe. Today, this situation is quite different. This was anyhow the starting point from which Finland started to build its welfare society and implementing a health and social policy based on the idea of cross-sectoral cooperation from the 1960s forward. It was possible for Finland to develop because it invested in the welfare of its people. Cooperation enables to solve major issues in society. Since 1980s, one of Finland's goals has been eradicate homelessness. There has been an extensive political consensus on the matter. Being homeless is a tragedy in itself, but the trend has been positive. The number of homeless people is declining in Finland. A key principle in the Finnish fight against homelessness has been that people are not required to change or regain their health before being provided the apartment. Instead, they should get an apartment first, and only after that they can focus on getting their life back on track in other respects. In other words, it is possible for societies to provide equal opportunities for everyone, even when life has not treated them well. It is important in the welfare, it is important to invest in the welfare of children and young people as they are the future, as Tit said quite a while ago. A known Finnish social innovation, we are speaking quite often social innovations as well, not only the technical innovations. One of those are the maternity and child health clinic system, created in Finland more than 100 years ago. By 1950s, this system covered the whole country in Finland. Another Finnish innovation is provision of free school meals, which were introduced in the 1940s. The comprehensive health monitoring offered free of charge both mothers and children through the maternity and child health clinics, significantly improved health among mothers and children. On the other hand, balanced school meals of good quality have enhanced the nutrition of children and young people, thus improving their health and the equal opportunities for education. One key aspect of happiness in Finland is trust. While trust in both other people and different institutions remains at high level in Finland, we have also witnessed worrying trends in the population trust in our health system and its ability to deliver services that meet the needs of the population. To support the happiness in the world, we must work every day to ensure that the people, but also the health professionals and politicians trust that the investment in health systems are worth it. In addition, to sustaining trust in the key institutions and improving the population's health and well-being, we are also facing existential challenges related to sustainability. Climate change, biodiversity loss, and overconsumption of natural resources affect people's health and well-being everywhere. If we do not recognize these threats now, they will have a crucial, maybe even disastrous impact on the health and well-being of the generation coming after us. Ladies and gentlemen, even in the past decades, there have been turning points that have required society to refocus the direction of the choices it makes. In Finland, we have earlier examples of decisions Finland has understood and dared to invest in people's health and well-being early enough to build a functioning society. This kind of work takes a lot of time, but it is too easy to tear down earlier achievements. Just like Portuguese explorers, we public health professionals must continue looking for knowledge and report on our findings extensively. We must ensure that there is an accurate research information available to support decision making. When in 1 year's time we get together in Helsinki, in our conference program, we want to underscore the fact that improving public health is an investment, not an expense. By investing in health, we support social, economic, and environmental sustainability. Investing in health benefits society and promotes a sustainable economy. This is the message we also want decision makers to hear. And on this message, we want to focus particularly attention when we meet again next year. I wish you all warmly welcome to Helsinki in November 2025.
Thank you so much. Thank you so much, Ilmo. We'll be looking forward to see you and everyone else in Helsinki next year. I have a card here that says 1 minute left, so it's very familiar to all of you for sure. I'll try and be very brief. We'd like to thank all the people who presented. We showed their work here in the conference, all the partners that help us organize the different plenaries, the speakers that are in the plenaries, all the companies that make it happen, because it's also a very significant effort, the ISC, the EUPHA Conference Board, the ICC, the EUPHA Council. I'd like to invite on stage now Sonia, the partner in crime. It's been a very an incredible adventure to organize this conference. I'd also like to invite both Iveta and Tit back on stage, please. I'd like to invite the presidents of the two national organizations that also supported this organization, so Patricia Martins and Gustavo Tato Borges. The organizing committee, we had a team locally that helped put this event together, so please also come on stage. I'd like to thank the EPH team and all of you that also had a big support to us. So please come on stage. the EUPHA office team, which we worked all together to make this happen. So also the EUPHA office team, please come. I know there's several of you that are new to the team, so it's also an opportunity to be here on stage. And our volunteers, the people with the green polos did an amazing job. So keep your hands together for them. Come on stage. All of you. And this is really the last thing we're gonna do before we let you all go. We wish you enjoy the city. We wish you enjoy Portugal. Have a safe travel back home. But before you go, we'd like to invite you to sing with us. And what we'd like to have your help is for Public Health, the musical. And we who are on stage, we need to shift to the side so that the audience can see the lyrics because it's subtitled. So please sing with us. Let's shift, keep the medium free. I'm not doing the rhythm. I'm really trying to put the slide forward. So this is the initial part, but we'll sing the chorus only.
See it through. My mission's clear. There's work to do. I dream of a world where health can thrive, where people and nature come alive. Less pollution, more connection, building up a shared foundation. In every town, in every place, we'll build a safer, healthier space. Together we rise, we'll thrive in a world where health can thrive.
Thank you so much for this. So I have a challenge for Ilmo. Let's rehearse before Helsinki so we do a better job there. Safe travels, everyone. Thank you.